What's up, everybody? It's your boy Volt. Just finished taking my notes for neuro disorders for pediatrics. Currently in peds right now for my BSN program, and that's what I just finished studying. So I'm about to move forward to the next step of studying, which is kind of reinforcing the knowledge by rereading it and reviewing it. And then I'm going to kind of train myself to apply this information to an exam, which I'll probably go over a little later. Just wanted to kind of show you how I acquire information and knowledge. I study in phases. So first is the learning phase, which is I take the PowerPoint and I take the information from the book and I try to get the information. And once I acquire the information, I reinforce it and review it just to test my retention, and then I do the final stage of understanding the material, which is taking exam questions and learning to use this information on an exam by practicing, which I will go over a little later, but for now it's acquiring the information in the first place. So I'm going to go to my PowerPoints that I got for school, which is neuro, neuro. And these are the notes I took on Google Docs. If you don't use Google Docs for nursing school, I highly recommend you take your Google account, get Google Docs, and start using it. You can collaborate with your classmates, and you guys can work on things together. I am a bit of a Sigma male, which is kind of like the lone wolf, but I do have my right-hand woman. She tends to basically help me out, and we tend to partner up sometimes. But when I don't have my right-hand woman with me, I'm always doing my own thing. And basically, I made all of this myself. It's a table I've made. It's my way of taking notes. So when you go over a disorder, you have your disorder, you've got your etiology and your pathophysiology. It's left blank here, but no worries. I find the information. I can go through my official Wong textbook, and if I can't find what I'm looking for there, I'll find other ways to answer my questions. For this particular one, I went with my old Hurst book, which I put the etiology, what is it, what causes it, risk factors, what causes it, so, tumors can cause it, hemorrhagic stroke can cause increased intracranial pressure, getting a stroke, but for kids, trauma, excess CSF, such as when you get meningitis, and then what does it manifest as? A change in LOC, or change in blood pressure, causes you to puke, and so then you start getting, like with little kids, these high-pitched cries and all this stuff. So I get my information mainly from Wong, but if I want supplemental information, I get it from Saunders as well. So what you're looking at here, let's see, is this? Yeah, let's see. So increased ICP. I type it here, Control F. So basically, if I want to find something, Control F, increased ICP. This is the Saunders NCLEX book. So this is so I'm gonna show you what this is. See, it's go to all the way to the cover, Saunders NCLEX RN. If you ever want to buy this book, it's a book, and I highly recommend it. I might do a little book review on it when I get my physical copy. But yeah, increased ICP, and you are going to basically find it. Assessment of increased ICP, early signs, I put it there, late signs, interventions. What are you going to do as a nurse, right? Medical management, I like to put my diagnostics here, but also what is the doctor going to do? What is the surgeon going to do? I put surgery to repair the injury, along with the medications the doctor is going to prescribe, right? Medical management versus nursing interventions. What is the doctor or the pharmacist going to do, or the physical therapist on medical management? What is the nurse going to do? in nursing interventions, because you, as the nurse, are going to follow the physician's order. You are also going to autonomously make your own plan of care and implement it. So that goes here. And what can result? If there's any bad thing that can happen as a secondary result, I put it right here. Such as meningitis, it can cause increased ICP, and you're going to get this whole clusterfuck right here, basically. So, etiology, pathophysiology, risk factors, which, you can find in the ATI book. This is ATI 2019, meningitis. I find meningitis, and let's see the disorder itself. You know what, I'm going to PDF reader here. I'm going to open up my ATI book. Meningitis. So, meningitis and bacterial meningitis, which is actually worse than viral meningitis. So right there, viral, bacterial. What are the risk factors? Viral meningitis, I put the risk factors right there. Bacterial meningitis, you can also see the risk factors right here. Clinical manifestations, you can get them either from the PowerPoint itself, which is going to be, let's see. I think I put so let's go to meningitis here. And so I take the PowerPoint. Everything I do is based on my teacher's PowerPoint, and I just add to it. Bacterial, viral, and let's see, diagnosis, and then any gaps in information. Right? You take this, I transfer it there, I take notes, and any gaps in information I fill with either the NCLEX book, the Wong textbook. I have a physical copy which was issued to me by school, but I also have a personal 10th edition digital copy, so I can control F everything. Anyone that knows how to use a computer knows that control F, it will control F for find, and then you just type meningitis or something. And, you search away. Bacterial meningitis. See, it took me right there. I didn't have to flip through my textbook. It just took me right to it. It's called delegation, folks. Or automating. Why should I look and try so hard when I have an AI to do it for me, right? So, there you go. Meningitis, clinical manifestations, medical management, nursing interventions, complications. So, when you study a disorder, whether it's for medical surgical or for pediatrics, structurally it's the same. I mean, all pediatrics really is, it's kids med surg. So you got the diseases, you got the ETO, you got the patho, you got the risk factors, you got the clinical manifestations, you got the medical management, you got the nursing interventions. But what's the difference between peds and med surg? Their bodies work differently, so you have to adjust the dosage according to their body weight, and you basically have to consider developmental considerations, Erickson's stages. How you handle a 2-year-old is going to be different from how you handle an 8-year-old or a 14-year-old. Keep that in mind. And that, my friends, is how you study for pediatrics, basically. Or that's how I study. This is my build. If you want to copy and emulate it, go ahead. But everyone's different. This is just my way of studying. Have a good day. Study hard. Volt out.